Hi, this is Dr. Carrie Kramer-Webb from Resurgent Sports Rehab, and today I'm going to be talking about lateral or side hip pain in runners. There are a lot of structures on the side of your hip. There's a whole bunch of muscles that attach into the femur. There's a fluid-filled sac in here called the bursa, and there's also a band, the iliotibial band, that can snap across this area. But I'll tell you, the most common lateral hip pain in runners is actually an inflammation in the tendons. So if we look at the gluteal tendons, we have the gluteus maximus, it attaches here, the medius here, and then there's a whole ton of other gluteal muscles that rotate the hip. But look at where they all attach, right into that femur. This is a super hot spot, and it can also be misdiagnosed as a bursitis, but it's often an inflammation of the tendon. Here's what's important to know about that. Why it happens is because of sloppy movement at the hip. So when you're running, this pelvis should only drop about 5 degrees from side to side, and it should be nice and smooth. When you don't have good stability in the leg, it can drop much faster to the 10 degree or 15 degree, and that will put a lot of strain on the muscles that attach to the outside part of the hip.
In order to test for gluteal tendinopathy, you're going to do a single leg test. You're going to get 1 inch away from the wall and try to stand on one leg. If you have pain in the lateral hip, that suggests gluteal tendinopathy, and especially if your hip drops into the wall, that tells you that you have poor hip stability and further lends to a gluteal tendinopathy diagnosis. To fix a gluteal tendinopathy, you're going to want to address the soft tissue with a foam roll. You can take a figure 4 position on the side that hurts. That will expose the tendons to the surface, and then slightly lean to that side and roll across the tendon. In order to strengthen and form some hip stability, start with the runner single leg squat. You'll start with it statically in about 45 degrees of knee bend and just push against the wall 10 seconds times 10. You should keep the pain at a 3 out of 10 or less, and as soon as you can create a dynamic runner single leg squat into the full squat and up. The key is to push against the wall and keep that right leg stacked.